Nabila, what are you doing?
Natasha, what are you doing?
We are checking on our oral health.
Hi everyone, I'm Nabila and this is Natasha, and we'll be talking about oral health today. So stay tuned for some useful tips on how to maintain good oral hygiene, as there are fantastic prizes to be won if you can answer simple questions at the end of the live chat. We have a unique product which is exclusive to Guardian to be given away to the lucky viewers.
Nabila, our smiles are very important, but did you know that your smile and your overall health depends on simple dental care habits such as brushing and flossing? But how do we know if we're actually using the right techniques?
Well, it's not as simple as brushing teeth twice a day daily as we are often told in school, Natasha.
Correct. Oral health begins with clean teeth, and keeping the area where your teeth actually meets your gum clean can prevent gum diseases, while keeping your tooth surface clean can actually help to prevent and stave off cavities and gum disease. Well, we should consider these brushing basics. You need to brush your teeth twice a day, and when you brush, do not rush. Take about 2 minutes to give a thorough job. Also, Nabila.
One tip I learned is that, which is very useful, is do not brush right after eating, especially if you had something acidic such as grapefruit or soda. It is because the acid from the food will weaken the tooth enamel, and brushing too soon will remove enamel and cause tooth decay. Besides that, choosing fluoride toothpaste is also important. Natasha, have you ever wondered why we need to choose fluoride toothpaste instead of non-fluoride toothpaste?
No.
It is because fluoride helps to prevent tooth decay by slowing the breakdown of enamel and increasing the rate of remineralization process that help repair enamel before cavity forms.
I see.
Not only that, Natasha, using proper equipment such as soft bristle toothbrush that fits your mouth also playing a major role in keeping your gum healthy. You can also consider using an electric or battery operated toothbrush, which can reduce plaque and a mild form of gum disease, gingivitis, more than does manual brushing. These devices are also helpful if you have arthritis or other problems that make it difficult to brush effectively. Also, don't forget to clean your tongue, which harbor bacteria, by using toothbrush or tongue scraper.
I see. So good techniques is also important besides knowing what tools to actually use. So now here's a good technique. This is a toothbrush, okay? Hold it at a slight angle, okay, not like this, not like that, at a slight angle, and then make sure that the bristles would actually touch the area between your teeth and your gum, and then you go back and forth in a circular motion, and do this very slowly, and make sure that you are not using your entire strength to actually brush it thoroughly like this vigorously, because this will actually make the tiny bristles to hurt your gums, and then that will cause bleeding.
Yes, and to keep your equipment clean is also important. Always rinse your toothbrush with water after brushing, and store your toothbrush in an upright position and allow it to air dry until using it again. Try to keep it separate from other toothbrushes in the same holder to prevent cross-contamination. Do not routinely cover the toothbrushes or store them in closed containers, which can encourage growth of bacterial mold and also yeast.
Nabila, do you know how often we should replace our toothbrush?
Maybe every 6 months?
No, actually every 3 months, or in fact even sooner. And the same applies if you are using electrical or battery operated toothbrush. You should actually change it every 3 months or sooner. Well guys, if you have just tuned in, I'm Natasha, this is Nabila, and we're speaking about oral health, everything you need to know about your oral health. So stay tuned with us until the end of the show, and you will be one of the lucky winners to walk away with this exclusive and exciting prize.
So Natasha, how did you know that your toothbrush cannot reach the tight spaces in between teeth and under the gum line? And that is where the bacteria harbors and grows.
Ew, gross. Then what should we do?
Floss. So that's why daily flossing is very important. So when you floss, do not skim. Try to bring up about 18 inches of the dental floss. Win most of the floss around the middle finger on one hand and the rest around the middle finger on the other hand. Grip the floss tightly between your thumb and forefingers, and please be gentle. Guide the floss between your teeth using a rubbing motion. Do not snap the floss into your gum. When the floss reaches your gum line, curve it again 1-2 and making a C shape.
Okay, so you should actually take one tooth at a time, and you have to slide your floss in between the teeth and then slide it up and down and then remove it. So basically, if there is any food particle that is stuck, by doing so, you're actually scraping the food particle off. Now, if let's say that, you should actually use the floss to gently rub at the side of the teeth as well. And then keep it up. Like if you find it very hard to handle, we also have other flossing materials that will actually help you, like this. This is called an incidental brush. It's good actually because it has a holder and the bristle here, and then you use the same technique. Well, besides that, you can also use like a dental pick, pre-threaded flosser, and also water flosser or wooden or silicone wedge plug remover. As long as you do a thorough job, it doesn't matter whether you are flossing first or brushing first. If you still find that this technique is difficult to achieve, trust me, I was one of them when I first started flossing. You can actually go up to your dentist and you can tell them to teach you the right techniques to floss.
That's right. So we have talked about all the oral hygiene and how we can clean our teeth and gums properly. But did you know that your oral health is connected to many other health conditions? There is increasing evidence and studies to prove the impacts of gum inflammations and gum diseases on various illnesses. For example, it can trigger heart attack or strokes, worsening diabetes, causing premature or low birth weight babies.
Speaking of which, right, even using a dental toothpick can actually lead to gum disease. So just a reminder again to actually use a proper floss or incidental brush and not your toothpick. And this oral health and also chronic disease are a two-way street. Some chronic diseases can cause problems in our mouth. Likewise, some oral issues have been linked to certain chronic diseases or even conditions.
Yes, diabetes is a disease that affects your body's ability to process sugar, but it can be managed with treatment. If it's left untreated, it can cause many kinds of problems, including some in your mouth. This includes the less saliva that will make your mouth to feel very dry, and it will enhance more cavities in your teeth. It's because saliva is needed to protect your teeth from cavities, and it also can lead to the gum disease and also infections. As we know that diabetes is related with the slow healing process. So if you have cold sore or cuts in your mouth, it may take longer for you to heal. So if you have just tuned in, guys, we are talking about oral health right now. Yes, today is all about teeth, and there are exciting prizes to be won. We have a free gift to be given away at the end of the talk if you can answer the simple questions.
That's right. Hello again, everyone. So we were actually just talking about how oral health can affect your overall health and also vice versa. If you actually have a poor oral health, you're more likely to get diabetes. So what is the connection, right? Now, gum disease is an infection. When we have an infection, our blood sugar naturally rises up. So then if you do not take care and you let this infection to grow, your blood sugar will continue to rise, and this may have a risk for you to get diabetes. Apart from diabetes, we can also get cardiovascular problems, which means anything that has got to do with your heart. See, our mouth contains hundreds of different kinds of bacteria. A healthy mouth has the ability to fight off the bad bacteria that can cause diseases. When you have gum disease, which is an infection, or any other problem in your mouth, you lose the ability to fight off these germs. And many studies actually show an association between gum disease, which is also called as periodontal disease, and cardiovascular disease. The bacteria in our mouth can cause certain types of infection and inflammation, and this research actually suggests that heart disease, clogged arteries, and even stroke could be related to this, you know?
Yes, Natasha. And another cardiovascular condition linked to oral health is endocarditis. This is an infection in your heart, which usually occurs by bacteria in the bloodstream that attach to weakened areas of the heart. This bacteria could come from your mouth if your mouth's normal defense are down. It's scary to know how important to take good care of our oral health and what it could lead if we are not taking care of it properly.
Exactly, and this is even scarier. Apart from all this, it can also lead to cancer. You see, more than 1/3 of cancer patients experience problem with their mouth. Cancer and its treatment methods will weaken your immune system a lot, and this actually makes it more likely for you to get an infection, especially when you do not take care of your oral hygiene and leads to unhealthy gums. Then this will actually cause side effects that affect your mouth, which includes mouth sores, dry mouth, sensitive gums, and also jaw pain. Okay, so anyways, for those of you who have just tuned in, I'm Natasha, this is Nabila. We're speaking about oral health, and we have actually come to a point where we are discussing on how oral health can cause many sorts of relatable diseases.
And the last one will be the preterm birth. Did you know that severe gum disease has been linked to preterm level and low birth weight in babies?
Oh my god.
Yeah,
no.
that's scary, right? Research suggests that oral bacteria can affect the placenta and interfere with the growth and development of the baby. It also shows that a severe oral infection could trigger level 2 early. This could cause the baby to be born prematurely.
Who would have actually thought that by just taking care of this little bit part of your skin can actually prevent a lot of other serious diseases, right? So well, some of the symptoms which includes like when you should actually go up to your dentist and get a checkup would be when you have red, swollen or tender gums, bleeding when you're brushing or flossing, gums that are pulling away from your teeth, sores or colored patches in the mouth, and also persistent bad breath or a bad taste in your mouth. Now, if let's say you have just eaten garlic, then you don't have to go to the dentist.
Yeah, whether you have a chronic disease or are at risk for one, you need to take good care of your mouth. So follow this tip for good oral health. So first, use the right equipment, soft, brittle toothbrush or battery operated toothbrush. Brush your teeth twice daily with fluoride toothpaste. Floss your teeth every day and use mouthwash. Get regular checkup with your dentist at least twice a year. Limit starchy and sugary foods and drinks. And please treat any symptoms of dry mouth if you may have. For example, drink a lot of water, use sugar-free gum, use a saliva substitute or oral moisturizer, and please stop using tobacco as the nicotine in tobacco reduces saliva flow.
Right, so what actually causes the saliva reduction? Well, this is actually a condition that we know as serostomia. So just to mention a few, first will be medication, such as antihistamine, your allergy medication, antihypertensive, and also anti-inflammatory drugs. Besides that, your lifestyle, too much of alcohol, smoking, prolonged stress, or even prolonged air travel can actually cause saliva reduction. And a reduction in the salivary enzymes actually disturbs the mouth natural flora, which allows bacteria to flourish, leading to bad breath, tooth decay, gum disease, and also ulcers.
Yes, Natasha. So today we have just the product for you today called Oral 7 Moisturizing Mouthwash.
Right.
Okay, it contains natural antibacterial enzymes to help reinforce your mouth's own defense system. So it moisturizes, clean, and also protect your mouth. So it contains 3 powerful and natural enzymes that helps to balance your own flora. So there are Lactoperacidase, it's a Lactoperacidase, glucose oxidase, lactoferrin, and also lysozyme. So I repeat it again as it is very important. So Lactoperacidase, glucose oxidase, lysozyme, and also lactoferrin. Okay, so what is lactoperacidase and glucose oxidase? The benefits. It works together to generate iron, which is a strong antimicrobial agent. So the lysozyme is a natural antibiotic that destroys the pathogenic bacteria by attacking the protective cell walls. And the last ingredient, which is lactoferrin, it helps to, it's an iron binding protein that deprives the pathogenic bacteria of iron and preventing them from binding to the host cell.
Right, so this product, besides all of that Nabila has mentioned, has no alcohol and no menthol, which means that there will be no burning or stinging sensation when you actually rinse your mouth with. So in a layman term, what exactly these 3 ingredients would do is that it neutralizes the acid, therefore maintaining a neutral balance of pH. Also, it has extra beneficial for dry mouth sufferers. If you all can recall, we have mentioned that cancer patients or people who are not well would tend to have dry mouth, so this is actually a very effective product for you. It also helps to keep your breath fresh, and it helps to promote healthy gums, and it helps to clean away the bacteria associated with bad breath, sore gums, cavities, and also plaque.
So how to use this Oral 7 Moisturizing Mouthwash? So you just gargle twice daily or as frequently as required, same just like how you use other kind of mouthwash. So the good thing is that the Oral 7 is also recommended for cancer patients as it reduces the dry mouth related with chemotherapy and also radiotherapy.
So in a summary, actually our oral health is very, very important, as if we just do not take care of it, it can actually lead to many diseases that we wouldn't even think it could happen. And this product over here is one of the best products, and it's very easy to remember because it cleanses, moisturizes and protects our oral hygiene. And so we have actually come to the end of the show. We hope that you have a better understanding on your oral hygiene. You are more convinced to see your dentist right now. And we will have one question that we would like to ask you. If you could actually answer this question well, then you'll be the lucky winner to try out this amazing product. What are the 3 main ingredients in Oral 7 Moisturizing Mouthwash? I repeat, what are the 3 main ingredients that Nabila has mentioned in Oral 7 Moisturizing Mouthwash?
Yes. So the information provided in this live chat is not meant to replace medical diagnosis, and viewers are advised to seek medical guidance when necessary. So before we sign off, do let us know what other topics you would like to hear from us. Until then, stay healthy and happy. Bye-bye.